Hi, I'm Krish Patel, and I'm presenting data from the ongoing first-in-human phase 1 dose escalation study of the investigational CD47 blocker, TTI-622, in patients with advanced relapsed or refractory lymphoma. CD47 is an immune checkpoint that binds signal regulatory protein alpha and delivers a do not eat signal to suppress macrophage phagocytosis, shown here in Figure 1. Tumor cells, including B and T cell lymphomas, frequently overexpress CD47 to escape immune surveillance. TTI-622 is a fusion protein consisting of the CD47 binding domain of human SIRP-alpha linked to the Fc region of human IgG4. It is designed to enhance phagocytosis and anti-tumor activity by preventing CD47 from delivering its inhibitory signal. Importantly, preclinical data indicate TTI-622, unlike other anti-CD47 antibodies, does not bind to human red blood cells as shown on Figure 2. This is a phase 1 dose escalation study with a 3+3 design in relapsed refractory lymphoma patients. Data for patients from cohort 1 to cohort 5 who were dosed from 0.05 milligrams per kilo to 4 milligrams per kilo are shown here. Enrollment is ongoing with additional subjects enrolled in cohort 6. Here in Table 2, we see all and related adverse events occurring in more than 2 patients. The majority of adverse events in cohorts 1 through 5 have been grade 1 and 2. No related grade 3 or greater anemia or thrombocytopenia has been observed to date. Related grade 3 or greater adverse events have been limited to neutropenia occurring in 2 patients, one event of grade 3 intensity and the other of grade 4 intensity, each resolving within 1 and 4 days respectively. There have been no related serious adverse events or dose-limiting toxicities to date. Here in Figure 4, we see that moderate and manageable platelet decreases have occurred immediately following dosing and have recovered quickly to baseline levels. Similar transient decreases followed by prompt recovery have also been observed with hemoglobin and neutrophils. In Figure 5, we see the response data for a 78-year-old patient with non-germinal center B-cell subtype DLBCL who had had 4 prior lines of therapy. This patient was dosed at 0.8 milligrams per kilogram, achieved a partial response by PET-CT at weeks 8, 16, and 24, and achieved a complete response by week 36 by PET-CT. This patient's response has been ongoing for approximately 1 year. In Figure 6, we see another subject's response, an 81-year-old patient with GCB subtype DLBCL who had had progressive disease with the 4 prior lines of therapy. This patient was dosed at 4 milligrams per kilogram and achieved a PR by PET-CT at week 8. This response has been ongoing for approximately 4 months. In conclusion, TTI-622 administered weekly IV is well tolerated at doses up to 4 milligrams per kilo. Related anemia and thrombocytopenia of grade 3 or greater intensity have not been observed. Preliminary data indicate dose-dependent increases in PK exposure in the dose range evaluated. End of infusion receptor occupancy at 2 milligrams per kilogram was above 60%, with sustained receptor occupancy at 24 hours observed at dose levels of 1 milligram per kilogram and above. Objective responses in 2 DLBCL patients occurred within 8 weeks and include both a PR and a CR, both ongoing through days 90 and 340 respectively. Further dose escalation is ongoing. On behalf of all the authors, I'd like to thank all the patients who participated in the study and their families, and the study staff from the sites listed below, the sponsor, and the CRO.